for allowing us to have this kind of presentation. They've hosted us for a number of years now, and we hope that it's beneficial for those in attendance to really get to know a little bit about what currently is going on with respect to the Kratom, both the accessibility for consumers of Kratom products that are properly formulated, that are labeled and age-gated, which of course are the foundational principles of what we fight for. I would also like to recognize a couple of special guests. Recently, I was invited to attend a conference in Thailand, and as many of you know, Thailand removed their ban on Kratom in 2021. That was initiated with a discussion with the then health minister, Newton, in 2019, and then over a period of 2 years, as they worked on it and developed the regulatory structure that they wanted, they achieved this dramatic change in the way that Kratom is regulated in the country of Taiwan. I'm sorry, Taiwan, listen to me, in Thailand. And so I had this great opportunity to go there and talk to some of the Thailand officials, and clearly they are committed to establishing a framework, regulatory framework, to make sure that the materials that are produced, the Kratom materials produced in Thailand, are going to be properly tested along the way. And there was a participant there who I wanted all of you to meet. It's Sheila, then Tuan, who's with a testing company. And you should all, before you leave and she leaves, you should say hello to her, because she's helping in, yes. She's helping in Indonesia, where they critically need testing requirements to make sure that the materials do meet the wholesomeness and quality standards that are required by the FDA, and it makes all of your jobs as manufacturers and distributors much easier if those materials arrive in the United States having been properly tested out of Indonesia. And of course, those of us who have had the opportunity to travel to Indonesia and see exactly what the circumstances are about how these materials are produced, there is a critical need in Indonesia to match what Thailand's doing in terms of improving those regulatory standards as they go forward. So thank you for Sheila for being here. I think she'll be a great asset to the entire industry as she develops, in conjunction with the Indonesian government and hopefully with the Thai government, the testing standards that are required. And always, when I'm in Vegas, I've got to tell you that some of the most magnificent people that are really committed to a cause that all of us should and do hold near and dear, and that's the Gidries with their Forgotten Not Gone program, where they serve veterans. They are magnificent. They've traveled to Washington, D.C. to tell their experience and the veterans' experiences with Kratom and how it's helped them. And they are truly inspirational in the way they do it. So thanks to both of you and for the leadership and for the commitment and, as I said, the marvelous organization that you've developed in order to serve those veterans. So thank you for being here. We're gathered here today because we want to talk about what the current situation is in the United States with respect to this tension between natural kratom leaf products, defined as the typical things that we see, along with properly extracted kratom products, meaning that they are limited in the extraction methodology to FDA-approved food-grade solvents. That's the definition of a properly manufactured and formulated kratom product, against the other products that have been developed, the 7-OH products. And I can tell you that what you see on this first slide is actually happening. It's true, and I'm going to talk about it today as frankly as one can, that you have what is developing over the last year, the big 7-OH con job. And no one should be deceived that the number of bans that are being proposed in the states and in state and local governments is because of this tension that exists, that never should have existed, but yet is part of what I believe is a deliberately manipulated mechanism in order to create a profit center for a few people at the expense of the safety of kratom consumers. And every kratom vendor and manufacturer, based on reports that I've heard, have come to the same conclusion that their actually marketing of these products has diminished significantly because of one thing, and that is the 7-OH manufacturers and the distributors and the marketing people have misled the American people. When they entered the marketplace, that's what happened. They called it kratom. Now they brag about the fact that they no longer have to call it kratom because they have become they've penetrated the market so deeply that they're able to shift away from the actual designation as kratom. But I can tell you that as a matter of principle, they started this battle and they are now engaged in deliberate deception when it comes to federal and state legislators. And I want to talk a little bit about. But before I do that, I want to tell you that I have peeves, pet peeves. I think all of us do. I want to confess to you about what my pet peeve is. I'm going to tell you about two. The first is I hate drivers who cheat on the road. I hate them. We've all experienced it. I live about 40 miles west of Washington, D.C., and I have to drive, when I go downtown to meetings and hearings and that kind of thing, I drive on I-66, which is known politely as the Devil's Highway. And people that drive on that road are cheaters. They'll cut in front of you, they'll get every advantage that they can, and it drives me completely nuts. And it's my number two pet peeve. And here's an example of where I get into real problems. This is the exit ramp that I get off when I'm coming back from Washington, D.C. And this is this particular road. If you look at this, these two lanes right here are left-hand turn lanes to go into a shopping center, so they don't bother me. This lane right here is the lane that goes up through the Manassas National Battlefield Park. It is a one-lane road. And at rush hour, what happens is, as people come off this exit, respectfully, people line up in order to go up this one-lane road. There is a lane here where about 500 feet past the light, it makes a right-hand turn into the Northern Virginia Community College. And inevitably, when I'm sitting there waiting respectfully to be in that line, people will come up on this lane, and I know they're not going to the community college. They are cheaters. Drives me completely nuts. And so I have dreamt, literally, I've dreamt of the day when I can be number one. I get this first position right here. Because when that person pulls up next to me, I'm going to drive just fast enough to keep them in that lane. I'm not going to let them get ahead of me, and I'm not going to let them slide in behind me. So I'm just going to hold them in that lane. That's my dream. And then one day, my dream came true. I was number one in line, and I'm right here in this position, and a car pulls up next to me, right? Now, I'm ready. This is what I've dreamt about. And I said to myself, I need to be careful here because I don't want to be embarrassed. What if that person that's next to me is driving a faster Tesla than I'm driving, and they could beat me no matter what I do, right? Maybe. I don't think they're going to be able to do that because I own a Tesla. But you never know. So you want to check it out and you want to make sure. So I glance over just to check out the competition to see who's next to me. The punishment that I'm administering at that point is critically important, right? Because I'm going to hold them in that lane no matter what they do. I look over, and this is who I see. This is my wife, Alice. What is this woman doing? She's cheating. Yeah, she's really good. Really great looking babe. I respectfully allowed her to cut in because I'm not stupid. Yeah, 49 years and counting with this woman. So yeah, I let her in. No question. So my number one pet peeve are legislators who lie to federal legislatures, and I want you to see one in Louisiana. This is Representative Leo on the floor of the House of Representatives in Louisiana when she's carrying the bill that is going to ban kratom. It's come over from the Senate already, and she's explaining to her colleagues why they should vote for the ban in Louisiana on this bill.
What is the difference, or is there a difference between the leaf, the tea, and the synthetic version?
There is no synthetic version, Rep. Jordan, and thank you for the question. You might see an amendment that talks about synthetic kratom. It's an insult to all of us. When I saw an amendment like that, another member was going to bring it, and I said, tell the lobbyist who gave you that, I may have been born at night, but I wasn't born last night. Because in effect, what we would be banning is a product that doesn't exist. The reality.
By the way, I was the lobbyist that handed the amendment to the fellow legislator that she was talking about. This is what she said. And then she tells the legislators that the Department of Health in Louisiana, that the top scientists and researchers at the Louisiana Department of Health have confirmed there is no such thing as a synthetic version of kratom, okay? That's an interesting statement to make, and it goes to what is happening more and more about confusing people along the way, and certainly Representative Valeo. And I have no idea if she really believed that nonsense. I don't know, but she acted like she did, and the truth is that they're wrong. And if she said that the top scientists at the Department of Health and researchers in the department there were saying there's no such thing as a synthetic, I cannot believe that, because we talked to them and we told them about these chemically manipulated 7-OH products that are synthetic along the way, right? We told them. So 2 months later, you have Commissioner McCary, who on July 29th of 2025 stood before the American people, and he specifically said, and you can read it, that the scheduling recommendation that they were making to the Drug Enforcement Administration is between trace amounts, which he believes are safe and fine and not the focus of the FDA, and synthetic concentrated amounts. Now, I wonder what the FDA commissioner knows that the Department of Health in Louisiana doesn't know, or that Representative Valeo doesn't know, in terms of the differences between these products. And why? Why would Louisiana ban a product, a safe product like natural leaf kratom products, when they know the difference and should know the difference? It just is mind-boggling in terms of what goes on. I also, my pet peeve, hate legislators who lie to fellow legislators in Utah. This is the Health Committee, interim committee, preparing the legislation that ultimately was going to be deliberated by the Utah legislature.
Have you looked at the FDA's single ascending dose study and the findings that show no adverse effects up to 12 grams?
As far as studies, I'll tell you this, and I'm going to be really candid with this group. There was a lot of money spent on, and I'm going to call it junk science. I don't care if that's offensive. There was a lot of money spent by organizations that were making hundreds of thousands of dollars. I'm happy to send you the data that cooked up some of the science originally. I think the important thing when we look at the science, we have to look at the science today. We have to look at what is happening in the state of Utah today. And we've got experts here that testify that we have a serious problem. And I think that's far more relevant than science that the industry promoted in the past.
Now listen to this.
I phoned a friend, Representative Chevier, and that data you referenced was actually paid for by the kratom industry, and I can provide that, but I just want to make sure you know that. But no, thank you. We've had a good discussion, and I'd urge support. It is past time to fix this problem.
So Senator McKell can no more produce that than the man on the moon could. It's a lie. It's not true. He knows it's not true. But see how he built credibility? He said, well, I'm going to be frank with you, and I know it's not very popular, but I'm going to tell you the truth, you know? And that's the way he gets this credibility. And then he says, I phoned a friend, Representative Chevalier. I phoned a friend, meaning that I verified it. What I told you before, I'm now going to verify, and the verification is that I have absolutely proven that that study, that FDA single ascending dose study, was funded by the kratom industry. All you bad actors out there. Can you imagine? And yet, published just a month ago, is the FDA single ascending dose finding study, and the lead author on it is Chad Reisig. Does anyone know who Chad Reisig is? He's the chief science officer at the FDA, who organized and supervised this study. And it was funded by the FDA. And yet, Senator McKell, the great liar in Utah, says, you can trust me. I even phoned a friend. And I can tell you it's not true that the FDA funded that study. In fact, it was done by the industry. This is what happens, and why it's such a big pet peeve of mine, about these legislators who lie. And then there's the pet peeve of legislators who lie in Georgia about kratom. Now, the guy that I'm going to show you here, this is Representative Rick Townsend. He is the one who has been leading the battle to ban kratom for the last 3 years in the state of Georgia. He is the one who has said whatever he needs to say in order to convince people that, in fact, kratom is bad. He misleads his fellow legislators routinely. When he was specifically challenged in the Senate Health Committee hearing to answer a question about his piece of legislation, he was dumbfounded, and there's a famous picture, and Misty, you'll have to just account for it. If anybody wants to see the picture of Representative Townsend being directed by Matt Wetherington, the trial attorney who was behind the scenes pushing this ban, it's right there in public. When I challenged Representative Townsend at a committee hearing this past session, and I said to him, can you tell me this? And he sort of looked at me in this blank space in his eyes and said, look, I understand. You have to go back and check with Matt Wetherington on what the answer should be. Right? Oh, no, Mac, that's not true. I don't listen to them. We have a picture of him during a hearing where Wetherington had to get up from his seat and go up and whisper to Townsend what the answer to the question would be. And he covers his mouth when he does it, like he's whispering to him. It is bizarre. And yet Rick Townsend, in his effort to try to ban kratom, sat before the legislative committee presenting this information in the last session, and he, of course, lost his ban. And he was trying to recover, and he was getting information from Matt Wetherington and his other sources and the trial attorneys, and they had an amendment. Now, typically, when amendments are presented, they become immediately publicly available. All of the legislators on the committee can see it come up on their screens. Well, for some odd reason, Representative Townsend's new amendment didn't pop up. And so he was asked specifically by the chair of the committee, tell us what your new amendment does. Okay? This is important because he should have told the most significant aspects of this amendment. What he did not tell the legislators who were asking him to outline the specific changes that he was recommending in his amendment, one of them was that the only kratom that can be manufactured into a finished product has to be grown in the United States. It was in his amendment. He didn't share that with his fellow committee members. And we didn't know it because we didn't have access to the amendment, so we had no basis until after the committee hearing when we found it and we were able to share it. He's discredited on this issue. And yet the Speaker of the House, as a consolation prize, gave him the chairmanship of the Blue Ribbon Commission in the state of Georgia to oversee the commission about kratom products and how they might be harmful to the youth, okay? When I'm talking to Townsend, he is telling me, you just need to understand my problem here. He said, kratom is killing people. And I said, no, it's not. There's no level at which toxicity is proven that kills anyone. And I tried to explain it to him, and I thought, well, maybe I could explain it to him in an easy way. So I told him that if you were to take 1 ounce of milk and you then added 19 ounces of pure 190 proof Everclear, and you drank it down and the person had a seizure or died, would you call that a milk death? And he looks at me and he said, I don't understand. I said, I know you don't understand. I know why you don't understand. I said, why don't you ask Matt Wetherington about this? And that, for whatever reason, offended him, which is fine, because he is the puppet of the trial attorneys in the state of Georgia along the way here. This guy is crazy, but he is there, and we're going to have to deal with him. And so we have a plan to work on this blue ribbon commission in order to make sure that we are not going to have a problem with him in the future. At least we defeat him. Again, number one pet peeve, witnesses who lie to legislatures in New Hampshire to deliberately mislead them. Catch this one.
Chair calls John Cleveland.
John
Good
Cleveland
afternoon,
is
Chairman
the
Roy, members
lobbyist
of the committee.
for
There's recently an
HART.
emergency ban in Florida. The Attorney General has the power to emergency ban substances in Florida. In the following 2 weeks, overdose deaths went up 300%. People just went back to the streets, right? So they are now allowing for that ban to expire, by the way.
Okay, two things about what Mr. Cleveland just said that are not true. First is that he said after the Florida Attorney General implemented the emergency rule which banned 7-hydroxymetrogenine products, within 2 weeks, you saw a huge spike in overdose deaths. Now, what is true is that there is no known data capturing mechanism that would make that statement to be verifiable in any way. When asked about it, it was a screenshot of some posting that someone in the state of Florida put up. That was his verification, an anonymous, unknown source to post something that he screenshotted and then repeated to the legislature in New Hampshire to say, if you, oh, and this is scary, if you ban 7-OH products, then you are going to have a spike in overdose deaths. I mean, this is completely nonsensical, and yet that's what the 7-OH industry, he's the leading lobbyist for the HART group pushing forward. And there in New Hampshire, he deliberately said it. The other thing that he said was that the Florida allowed the emergency rule to expire. It will expire, hasn't yet. So he misled them there. And what he didn't account for is the plain fact that the Attorney General retains the authority to issue another ban on 7-OH. I think the next one's going to be a little more specific than the first one was. I think it's going to be harsher on the 7-OH industry because they've earned it. And you're going to see that rule be in effect for another year. But Mr. Cleveland didn't want to share that with the New Hampshire legislatures because that would weaken his case. He was trying to act like, oh, the reason that they lifted the ban was because it wasn't the right thing to do. No, it actually was because the 7-OH industry in the state of Florida was pouring in hundreds of thousands, more than $1 million into the campaign coffers of the Republican various leadership organizations and to individual members, and they bought their way into that. But they didn't and cannot buy their way into the Attorney General's office because he's telling them no. And at least we have a person of integrity. And we understand from all of the scuttlebutt, and I know this will shock all of you, that the Speaker of the House in the state of Florida, who was responsible for killing the bill that would have made that rule permanent, is very closely aligned with a very beautiful lobbyist from the 7-OH industry. And if you believe the stuff that's in the rag sheets in Florida, they're more than just a little involved in terms of their relationship. So why does this happen now? I think we have a better view of it. My pet peeve about witnesses who lie to legislators in South Carolina to deliberately mislead them. I was in Columbia yesterday morning, and this is what I heard from the testimony.
Thank you, Mr. Beckham. State your name for our record, please, sir.
Chairman and members of the committee, my name is Thomas Beckham, and I'm the owner of a Kratom Alkaloid contract manufacturing company here in South Carolina. First, last year's KCPA already banned synthetic alkaloids. You can check the text for yourself. It is very clear. I encourage you to review that language. If 7-O is synthetic, then it is already illegal. Second, Florida already rolled back its scheduling due to being unable to substantiate any claims around danger. The emergency scheduling expires on July 1st, and 7-O will be legal again in Florida. The amendment recommending a 2% limit on 7-OH is nonsensical. In practice, this means that my company could manufacture or could not manufacture a 5 milligram 7-OH product. However, I could manufacture a 5 milligram 7-OH product paired with 250 milligrams of metrogene. 250 milligrams of metrogene, which the liver converts into 7-OH at a rate of about 20 to 30%. This means the effective 7-OH in that product would be, that someone would ingest from that legal product would be roughly 55 to 80 milligrams of 7-OH. This methodology of regulation doesn't work. According to CDC data, South Carolina overdose deaths have fallen nearly 15% in the last 12 months. This occurred during the same time period that Kratom and natural 7-OH remained available on the regulated market through last year's KCPA and is working, evidenced by the 15% reduction in South Carolina overdose deaths in 2025.
Now, if you're a legislator sitting there listening to this and hearing this testimony, and I can tell you from personal experience, 45 years ago, I was elected to a legislative body, and I sat in hearings like this, and you rely upon the integrity of witnesses, and you can be deceived. And these legislators, now they're the upper body, this was a Senate hearing, so they're a little more sophisticated, but to believe that the bill in South Carolina bans synthetics is incorrect. And he knows it, by the way, because it was the 7-OH industry that stripped out the South Carolina provision last year that would have banned their products. But he's playing a little bit of a semantic game, because his definition of what a synthetic is based on the language that doesn't apply to him at all, but he's trying to work around it. But he then talked about, oh, look at the great value. Look at the number of South Carolina residents whose lives have been saved because Kratom was on the market. Again, no data collection mechanism exists in order to gather that kind of data the way he's expressing it, and yet he wants to claim that there's this great benefit. Now, what did happen in terms of the true reduction in opioid overdose deaths, whether you like it or not, is the federal government has cracked down on physicians that are prescribing opioids to patients that are suffering from pain. And those restrictions are so tight right now, a doctor cannot afford to prescribe these opioids except in very restrictive scenarios. And that's why you see a reduction in overdose deaths, because many of these people never get on the opioids. And any of us that have been through a pain situation after surgery or to manage acute and chronic pain understand this. But these restrictions are, whether good or bad, are why you're seeing a reduction in opioid deaths. Has nothing to do with 7-OH being on the marketplace. So what is happening right now? HART and 7 Hope Alliance have engaged in a pattern of deception to mislead legislators, public health officials, and consumers. And as I mentioned earlier, it is why you are seeing all of these bans that are being done at the state level, at the local county and local city council levels. And they are all over the country. They are killing us because of the misinformation that's being put out there and the presence of these 7-OH products on the market. Again, my pet peeve, people who deliberately mislead legislators in the state of California this time. Now, this is Miss Michelle Ross from 7 Hope Alliance. And I know she would like me very much to start addressing her as Dr. Ross, because she does hold a PhD, by the way. But I told her in a LinkedIn exchange that I would start calling her Dr. Ross when she started acting like a doctor. And in this case, she has told people that she is the preeminent Kratom and 7-OH scientist in the country. Now, I have to unpack that. I would like Ms. Ross to tell me how many peer-reviewed published articles that she has authored, particularly about 7-OH. But let's throw out 7-OH. Any peer-reviewed published article, you can Google it, or you can Google Scholar it, you can you can ChatGPT it. I can't find one. And how the most preeminent scientist, expert on 7-OH and Kratom in the country could not be peer-reviewed and published. I don't know how she gets there, right? But she did do a survey of 1,200 7-OH consumers. And she did identify the demographics, and she did identify the actual responses of those people. Now, let me tell you something. I have done the same thing probably a couple of hundred times. And not just related to Kratom, but on various kinds of projects that I worked on. So you can all take to the bank that I'm the most preeminent survey researcher in the country. But I've never had a peer-reviewed published article. So we're probably, you don't have to call me doctor, by the way. So this is what Michelle Ross said, and I'm going to give you a couple clips because they are astounding.
Number has not gone up over years, even though in 2023, isolated 7-OH products were introduced and would have been considered Kratom products because, again, the differentiator between 7-OH products and Kratom products is actually a false one defined by the Kratom industry, not by the science.
Okay, so the confusion about 7-OH products and Kratom products is because you, those of you that are in the Kratom industry, created this false narrative. This is what she's peddling to the California legislature in this testimony. It is astounding that she does so because it's frankly not true. The distinction and the difference between 7-OH products, and by the way, that difference didn't come on the market in 2025 like she represents. I thought for a long time that it did. I've now seen the evidence that the entry of 7-OH products into the marketplace probably occurred somewhere in mid-2021. And so if you want to do data set comparisons, you need to start looking at data from 2021 in all of the safety data that she wants to espouse, because that's the more accurate date. But she says that the massive market entry done by Vince Saunders and his group and her groups that support them are the ones that are coming out in that time frame. Here's another clip.
The background analysis and even the expert materials cited in this debate rely on falsified research that has required publication corrections, and this is rare, by the way, publication corrections for failing to meet editorial standards. So things like lying about how potent 7-OH is compared to morphine. One of the things that you'll hear that is 13 times more potent than morphine, or that it binds to the opioid receptor more strongly than morphine, or that even most of the products in the market are sublingual, or they bypass first pass metabolism. They go straight, into the bloodstream. These are all falsehoods that have actually been corrected in the scientific literature by addiction experts. So it's not just me, or it's not like industry experts. These are independent addiction experts that are going, the publications are wrong. There's something here. And there's also an ongoing investigation, an ethics investigation at the major Kratom Research Institute in the country right now.
Okay, so Michelle Ross says a couple of things there that are pretty interesting, right? First, she says that there have been a number of corrections that were required by Kratom researchers funded by NIDA, which that's principally where the funding comes from, that had to undergo a corrections procedure. I looked. I searched in every corner of the internet to find where those so-called corrections were required. Now, occasionally they do require them. I'll give you an example. Dr. Andrew Kolodny. Now, you should remember that name. Andrew Kolodny is coming for you. Andrew Kolodny's career is based on his entry into the opioid marketplace, where he was an expert consultant, where he made a fortune in being an expert testifier in opioid trials on behalf of the individuals that were so-called harmed by opioids. And it was his mission then to take that to the nth degree. And he was successful, by the way, in misleading people materially about some of the things related to opioids. But he was a crusader. He also then became a consultant to local governments so that they could get a piece of the pie of the opioid settlement agreements. And he was sanctioned twice by peer-reviewed published literature groups when he submitted information and failed to disclose those financial conflicts of his involvement in all this trial work and also other research, or not research work, but consulting work that he was doing with local governments. He was required to do it. So it happens. But you can find that. You can Google Dr. Andrew Kolodny and you will ask if he has been sanctioned, and he has been. But I can't find not a single example that Ms. Ross is referring to here about these so-called corrections that had to be made by Kratom researchers. Now, she also said that the problem with kratom research here is that it's just not very accurate, right? And that the people are just chewing on the 7-OH people, and that's really not fair either. Now, what I did find out, that research on 7-OH and kratom has required significant corrections and updates, primarily driven by the FDA, and on scientific studies published through 25 to 26 that reclassified the substance from a minor natural component of kratom to a potent, synthetic, and dangerous opioid. Now, I know Ms. Ross didn't want to say that to the California legislature, even though it's true that the real problem are the corrections for those scientific articles that misclassified 7-OH as a minor metabolite of the kratom plant. And so I can't account for why Ms. Ross made that material misrepresentation, but it's embarrassing, but it misled those legislators as they made this evaluation. Here's another good
However,
one.
it comes back to the same thing over and over again, that 7-OH is somehow different than kratom.
Think about that. Yeah. So my first experience with Miss Ross was during a Champ Show event, I think 5 years ago, and we had an event at Las Vegas Country Club, a lunch, and there was an individual sitting next to me who had just introduced himself, and he was a kratom vendor at the time. I've not seen him since, but we were just having a conversation, and Miss Ross came up and ordered him to move. She wanted that seat to sit next to me. And I thought it was odd that he moved, because I wouldn't have, but I guess she's an intimidating person. And she sat down and introduced herself, and she said, I'm Dr. Michelle Ross, and I've written a book called Kratom the Medicine. And she handed it to me. And I looked at it, and I said, well, I haven't read this, but I don't think that's the right message. Kratom the Medicine puts us into the gun sights of the FDA. It's Kratom the Dietary and Botanical Supplement. Oh, no, I've read it. And she pulls and opens the book, and she goes, how would you like me to endorse the book to you? I said, I'd rather not. And she got ticked off and left. And so the guy could come back and sit next to me. Bizarre. So I don't know how she gets there, but I'll tell you what she did. She found a comfortable seat next to the people at 7-OH, because obviously she'll say anything that she needs to say in order to make a buck when it comes to this kind of stuff. So now kratom and 7-OH are exactly the same things. They have no differences, none. And we should all understand that, because she has said it.
Not separate products. 7-OH is not a synthetic opioid. It is exactly the same whether it is found in the kratom leaf, and it is actually found. There are many papers that state this. It is found in the body as a metabolite. And it's also found in isolated products. So it's not some Franken, alkaloid that does not exist in nature. It is real, and it is the same chemical structure no matter where it comes from. Oxidation can happen via oxygen, via heat, via age. By the way, if you test old kratom, it will have elevated levels of 7-OH and also another metabolite called mitragynine pseudoindoxyl.
Okay, so here's the facts. The trace amounts of 7-OH found in naturally dried kratom plants is largely below quantification levels. But you heard what she said. She told the California legislative panel that kratom, or 7-OH and kratom, exist naturally. They do not. There is no 7-OH that has been scientifically found in any kratom plant. It is only after the leaves are harvested and laid on the ground that the oxidization process begins, which she accurately described, but she push the point that they're the same thing and nobody should be concerned about them. But importantly, if you take chemically manipulated material that uses high concentration chlorine and baking soda solvents to convert MIT into a dangerous chemically manipulated 7-OH opioid, it is different. Now, she doesn't want to account for that. She doesn't want anyone to believe that the chemical manipulation of 7-OH, and she frankly is very ticked off at me because I said in a podcast webinar that we did that in fact you're using the same chemicals that are used to shock your backyard pool, and it is hardly a natural process in extraction. And she went after me hammer and tong and said, how could anyone believe or characterize the materials that they're used in the oxidization to enhance 7-OH, to pull it out of the natural plant? How could you call it pull shock materials? Well, I was listening to Vince Sanders when he described the process, and he was trying to make it relatable to people. And he said, oh, it's the same chemicals. It's high concentration chlorine and baking soda that you use to shock your backyard pool. So why would she get so angry with me? Maybe it's because she doesn't like me. But why, when it was Vince Sanders, who is one of the principal manufacturers of 7-OH products in the United States, at least now, he's in a little bit of a trouble in the state of Missouri. So this is just what they'll say and do to mislead people along the way. There's no question that this is not a natural oxidization process. It is spiked by, stimulated by these chemicals that you use in your shocking your backyard pool.
Now, I will not discount the fact that there are some case studies of people who were highly abusing these products, and even riskier versions, like, for example, sublingual films, which I do not believe should be sold at all. But for the most part, people taking oral tablets, and especially responsible amounts of them, do not experience respiratory depression, and that's also something we saw with our research.
Okay. So 2 days after she gave this testimony in California, I went home, and I literally, in the middle of the night, woke up and I said, I'm not putting up with that BS. So I went and ordered from the major company supporting 7 Hope Alliance sublingual strips from 7 Ohms. And I got them 8 days later. I have it documented. I ordered another dozen products that are chewable sublingual tablets that are used to bypass the first pass metabolism system in our bodies. They're used to bypass the entire process because they want you to dissolve into the bloodstream, hit your mu-opioid receptors. And I walked the floor of this show, and I did it again today, asking the difference. This was last year, but I did it again today, asking these vendors of 7-OH products, the ones that didn't recognize me, and I turned my name tag over, and I asked them, what's the difference between 7-OH and Kratom? And every single one of them last year and this year says, oh, much more powerful. Last year they said, 7-OH will knock you on your ass. That was the description. Now, I don't think that's the kind of product that you want to take when you just want to feel better, when you want a little energy boost, when you want to have the advantage of managing some anxiety or acute and chronic pain. You don't want a product that's going to knock you on your ass, because we know what does that. Oxycodone. Opioids. We know they'll do that. And yet here we have this description by Ms. Ross, and she wants to reassure people firmly that they're not the same. All this nonsense about 7-OH being dangerous is a problem because it doesn't really impact you the way that we're saying. But here's the reality. Product forms that are designed, engineered in the 7-OH space to trigger addictions for profit. They're highly potent. And look at this particular product. It says, and on the smaller package, it says that it's 100 milligrams total, 1 tab, 8 servings total. Okay? If you look at the tabs, it's scored for 4. Now, what consumer is going to break it into 4s, let alone break it into 8s, right? These dissolve in your mouth, and they bypass your gut, which is where Kratom acts, and they go right to your mu-opioid receptors, and they knock you on your ass. And they make you euphorically high. And then you crave it when you crash 2.5 hours later. And is what triggers addictions. And that's not the way that natural kratom leaf works. It's been documented in the science, and there's no justification for anyone saying it. But these products, they make them highly potent, highly concentrated 7-OH. They flavor them for appealing results, understood on that. They're convenient and discreet tablets that are dissolvable in forms, are easy to hide, easy to use, and easy to overuse, which she complained about. But, you know, if you're told to break a 4-scored tablet into 8s, that's no problem for the average person, right? I mean, where's she coming from? This is a different planet that she's living on. And of course, these products are designed for dependence. That's the bottom line. And we have to be in a position to be able to fight back. But here's what the 7-OH manufacturers are saying about why all of these problems are showing up in the states and local governments. It's because there is a turf war between Big Kratom and Big 7-OH. That this is the whole center of the problem. She says it, she's wrong, by the way, because what this truly is a turf war between 7-OH products that are dangerously engineered in order to trigger addictions and overdoses versus the safety of consumers that consume Kratom products. Those same consumers who were misled in 2021 or 2025, whichever the right date was, or 23, I'm sorry, that led them to become dependent, and that's what the real issue here as we go forward. Here's the bottom line message, in my opinion. There is no middle ground, none, that exists between natural leaf kratom and 7-OH products. You can't live in the never, never land between the two. I know that it was appealing when 7-OH first came out because it penetrated the market deeply. It took customers away because those 7-OH manufacturers were telling customers these are kratom products. I sat in a hotel just about a mile and a half from here 2 years ago with the 7-OH manufacturers, and what they said to me, and it was obviously a choreographed script, was we market our products as kratom because we are required to do so by the FDA. I said, what are you talking about? You are not required to label your products by the FDA as anything. You have to have a fact supplement panel. You have to identify the actual ingredients on the product, but no one says you have to call that product kratom. But that was their excuse when they first got on the market. It's not one that makes any sense, but it's the reality of the situation. And today, we're in a crisis because of this kind of manipulation that has gone on. I hope all of you have read over and over again the consumer alert that the AK issued about these products. And this particular consumer alert was based on the complaint that was filed against 2 California manufacturers of 7-OH products by the Attorney General of the state of Texas. But the important part of this, and he described in detail the methodology that they used, they actually tested these products at the University of Florida for what their content was. In the 7-ohm 7-OH tablets, 14 milligrams, they found that there was actually 12.84 milligrams of 7-OH per tablet, and then 1.52 milligrams of metrogenine pseudodoxil per tablet. That's the bad stuff that Michelle Ross talked about. Like, oh, we would never do that. And yet it's in the product of the main manufacturer that supports the 7-Hope Alliance. I mean, this is craziness, and it has that kind of thing. But importantly, remember what the fellow said in South Carolina yesterday. He said, that 2% doesn't mean anything. That 2%, by the way, was recommended in 2019 before any 7-OH products are on the market to simply say that anything above the 2%, above it means that it has been manipulated, chemically synthesized. That's the standard. It's not, the 2% doesn't mean anything more than that. And if you convert that 2%, it's about 1 milligram per serving. And what was said by the witness that's a major 7-OH manufacturer in South Carolina was, I can just change the product. I can simply increase the amount of metrogenine in it to the point that I diminish the percentage of 7-OH that's in it. But what he left out was that if I do that, the FDA will swat me down, because there is a standard required by federal law that any product that enters the marketplace has to have a reasonable basis of safety. And I know that the FDA doesn't take, well, they're doing it, and so therefore I wanted to do it, and I wanted to manipulate the product the way I wanted to. I don't think that sells. And he left all of that out because he was trying to convince. He was trying to mislead. He was trying to lie to these legislators to convince them that 7-OH products were A-OK and not dangerous in any way. Here's Luma. Luma contains, it's a shot, contains 42.1 milligrams of metrogenine pseudodoxil. It has 0 7-OH. It's called Luma 7OH 80 milligrams nano. It contains metrogene pseudodoxil. No detectable levels of the 7OH that were allegedly in that product. Prestige, they're on the floor down here, by the way. I think these others all of these are. 7OH per tablet found 7.56 milligrams, but 8.80 milligrams of pseudodoxil. That's crazy. And that's what they're selling on the market today. Their 39% of 7OH percentage is far above the 2%, obviously, if you look at it. Opia, 7OH tablets, 80 milligrams. The amount of 7OH per tablet, 16.14 milligrams, 0.39 milligrams of pseudodoxil. They're 96% over the 2% level, and so they were cited. And here's Smurfs. Smurfs, and of course, that's not appealing to children. That's appealing to our inner child of adults, right? Smurfs. It doesn't have anything to do with kids. 7OH per tablet, 38.45 milligrams, 0.83 milligrams of pseudodoxil. These products are stunningly in violation of the law. And in this case, the idea that someone thinks that they could produce a product called Smurfs that isn't going to be interpreted by any reasonable public policy officials as being appealing to children, I don't know what universe they're living in, but that's the way they believe it. Now, if you haven't yet, you need to watch this entire video. I've only got a couple clips of it, and this is something pretty interesting. Whoops, didn't get it to work. Let's see if I do it this way. Well, this is unfortunate because obviously there's a glitch in this video, because this is a John Oliver who's a popular influencer that has a big base, but he goes through, you need to go, we'll circulate this, Stephanie, we need to circulate the link to this. I don't know why it's not working. But he goes on and identifies a couple of important things. He talks about how gas station heroin, which he defines as 7OH, is now flooding the marketplace. And he describes particularly how it got onto the marketplace in the first place. He has clips of interviews with Vince Sanders, where Vince Sanders first expresses he doesn't understand how this product that just sold like crazy in 2024 was selling more than all of his cannabis products, which he'd been in the business for 10 years on. And then there's another clip where they ask the question, the interviewer says to Vince Sanders, well, is it true that you don't have any scientific evidence to back up your market entry? And he says, well, yes, that's true. He admits it. Not a single scientific study. He said, we based the safety study on consumer use, and we have a lot of consumers who are using it. Well, first, that's not the way studies work, right? You're using human consumers as guinea pigs for your product. And now he's claiming we don't have any adverse events, which is not true. We don't have any deaths. That's not true. And yet he makes it sound like, this is a perfectly safe. And then he says in the middle of this that it's safer than, 7OH is safer than Kratom. I mean, crazy, crazy. I'm sorry that video didn't come through. So here's what happens when this hysteria grips about Kratom being the bad actor. The Great Saddle Ridge Kratom scandal. This is a school in northern Georgia where there were reports of 5 kids getting sick, and they were transported, these are middle schoolers, they were transported to the hospital. The reality is that without any toxicology testing that was done by the emergency room physicians, and a group of physicians examined these kids because they're all brought in at one time, so they coordinated with one another, they decided that in fact these illnesses were caused by Kratom. They were very specific about it. This is an email that we had the FOIA. I think we got 5 emails, it cost us $900 from the Walker County School Superintendent. And the emails were benign except for reporting that earlier today, multiple students at Saddle Ridge Elementary Middle School became ill after ingesting a substance later identified as Kratom, right? The symptoms that they presented when they got to the emergency room, nausea, vomiting, stomach cramps, dizziness or lightheadedness, and a rapid heart rate. All of the kids had this experience. One kid allegedly passed out. And of course, doctors are collaborating. And here's the email from the school administration saying it looked great, talking about the press release, but I would take out the highlighted because all the doctors did say that they were certain it was kratom. So a group of doctors treating 5 middle school students in northern Georgia, after evaluating all those kids, determined that kratom was the cause, and that became a big news story. I've heard that news story repeated in various legislative and Board of Pharmacy meetings around the country. Oh, kratom caused these kids to get sick, and all the doctors said it was kratom. I called the Walker County Sheriff and asked him, because he had opened an investigation. He wanted to find out where these kids had purchased their kratom products, because it is illegal in the state of Georgia to sell a kratom product to a minor. So he wanted to know how these minors got a hold of it. Legitimate question, and we certainly didn't think that was a problem. But we asked him if he would take the substance that he had recovered that allegedly was consumed by these kids and send it to Dr. McCurdy's operation and have it tested, which he agreed to do. And what he found was that the truth prevailed over the hype. What he found was that there was, after testing 116 drugs, no kratom and no illicit drug, none. And yet the doctors, all of them in the emergency room, had determined that it was an illicit kratom product. It turns out the kids had consumed boxes of dots very quickly, and they got involved in what is called dumping syndrome. The Mayo Clinic identifies what dumping syndrome symptoms that occur when you ingest a large amount of sugar in a very short period of time. You have a feeling of being bloated and too full. You have nausea. You have vomiting. You have stomach cramps. You have dizziness or lightheadedness or rapid heart rate. The material that was tested, that was sent by the sheriff, was dots, candy dots consumed by these middle schoolers. And you have a team of emergency room doctors who say it was kratom. Why? Why in the world would they have done that? What investigation did they take on? They did nothing other than it was popular, because as they discussed it later, they had heard from some conversations that kratom was getting in the hands of kids in the state of Georgia. Maybe 7-OH was. Maybe kratom was. I don't know. But I can tell you that those kids ate a box of dots in that particular deal. So here's the bottom line. The doctor's recommendation, I was just evaluated, they said that I have to reduce my stress and promote better health, that they asked that I eliminate one of my 2 biggest pet peeves, okay? So I had to make a decision this week. What were the pet peeves that I was going to release? And so I made the decision that I'm letting go of pet peeve 2, because I have to. And I'm sticking with pet peeve 1. And I think all of you, I hope all of you will join me in that effort, because we've got a big challenge ahead of us to fight back on all of these ban bills that are flooding the legislatures and local governments along the way. So that concludes the presentation. I'll now open it to any questions anyone has. The way we'll work this is, do we have a microphone? We have a microphone. You raise your hand if you want to ask a question, and if I can answer it, I'll do it, obviously. No one has a question? Up, right here. Mr. Guidry. Just yell loud and I'll repeat it.
I had a question about updates about dosing recommendations. Usually the number one concern with veterans that are trying travel for the first time, how many to take, and a lot of labels, they don't give you that instructions of what to take, but how much to take dose.
Okay, so the question was, a lot of veterans that he's dealing with don't know what the appropriate dose level is to start with, and some of the packaging doesn't give that. Every package should include a recommended dose, serving size, right? Everyone should. And if you're getting kratom that doesn't have that, I'd recommend you move on, because federal law requires it. And you, in order to establish what that serving size is for that product formulation, and it can be different. because there may be less metrogenine in the product or whatever. They need to identify what that level of a safe serving size is, particularly if there's elevated levels of metrogenine. So check it out. And now, the advice has always been go slow. If you're a naive Kratom consumer, start at very low levels, determine what works for you. Don't start high and try to come down. Start low and find the right level. You can increase it as you go forward. I think that's the best advice for Kratom consumers. And there's lots of chat boards on the internet where people have this experience willing to give advice on how to do that. Easy for me to say technically, well, the law says, but the experience that people have really is more informative, and you can get that information pretty readily on the internet from the Kratom chat boards. Right here, Mr. Darian has a question.
The National Drug Control Strategy 165-page document that recently came out, it's a lot to read. Is there like a quick summary you could give us?
Yeah, so what we're referring to is that 2 days ago, I think, the Office of National Drug Control Policy issued their strategy for how they're going to address emerging drug threats in the United States. And when you read it, it clearly makes the distinction between natural kratom leaf materials and synthetic. Sorry, Representative Leo. Now the Office of National Drug Control Policy is recognizing synthetics. For synthetic 7-OH products, that they want them banned, scheduled, and they are recommending that there be very strong restrictions on product availability of 7-OH. So that's good. There are a couple of things in there, and that's typical of government documents that are that long, that I would prefer not have been written because I think they're uninformed, where they gave case studies, a couple case studies of actual consumers that simply misinterpreted the data. But it was their story, so they published their story, and that was misinformed in my opinion. It certainly shouldn't have been a part of that document, but typical when they try to do illustrations along the way. But it's actually a great document, and it gives us a roadmap to really separate 7-OH versus natural kratom leaf products. And the new director of that office is, I think, really well informed on kratom at this point, has been open to learning more, and is working closely with stakeholders that can help her, inform her along the way. And I think it's important to note that the previous director of the Office of National Drug Control Policy, Dr. Relu Gupta, has evaluated all of the data on kratom, and he is solidly in our camp when it comes to the differences between the two products and what the public health threat that is that's out there. And that is mirrored by the former first Trump administration director of Office of National Drug Control Policy, who unfortunately now has gone on to lead a trade association in a completely unrelated area, and his board of directors don't want him messing with kratom, but he has published articles about it. So we now have 3 directors of that office who have clearly come down on the right place for what the national policy ought to be on kratom and 7-OH. Misty. Okay, so Misty is my whisperer. I promised her that, and I should have at the outset, that I would tell people or announce to people that we have concluded a date for the congressional briefing in Washington, D.C. It's a 2-part event. First part is that we will, the day before, which will be on June 2nd, thank you, June 2nd, we'll have a fly-in with kratom advocates. So we're encouraging vendors to come in, and we're encouraging you, and we'll set it up on the website where you can identify some advocates to sponsor some advocates to come to Washington so that they can participate in actual meetings in offices on June 2nd. On June 3rd, we will have a congressional briefing to discuss with staffers on Capitol Hill and hopefully some members to inform them about the correct policy framework for regulating kratom and for dealing with product formulation limits on 7-OH. And that'll happen in the the Capitol Visitor Center, and it starts at 11 a.m. Do you remember the room number offhand? HVC 201, the house side of the Congressional Visitor Center. And just for your information, you have to get there a little early because you have to go through a line and security checks. So while it starts at 11, you're probably smart to get there around 9:30 to get through all that. So that's an exciting event. We've had in the past Dr. Nora Volko, the director of the National Institutes on Drug Abuse. We'll invite her again to update us. And we've had some other leading policy wonks and scientists that hopefully will join us on that day. So David asked what the status of the recommendation that was made back on July 29th of 2025 by the FDA and HHS to the DEA to schedule 7-OH as a Schedule I controlled substance. The DEA has exhaustively gone through the evidence and data. The one issue that they have had trouble with is that there are follow-on synthetic products, Sudendoxil, the now MIT 11, 12, 18, the various numbers, and MGM 15 and 16, which are chemical derivatives of the 7-OH products, and how they appropriately can capture those even though there is not sufficient evidence and data to fully schedule them. So that's been the hang-up. I have zero credibility on this issue because I had been told and repeated to people, consumers and in the industry, that this would have happened already. And on multiple occasions, we were told that they were that close and they were ready to do it. Now, the latest rumor, for whatever weight you might give it, is that all of this has been signed off on by the DEA administrator. It's been shipped to the DOJ and gotten approval. The HHS and FDA have approved it. It is now at the White House Office of Management and Budget as of, if you believe the rumor, 2 days ago, and they have a fairly short time restraint on them to get it back. So I think that we're close, unless something derails that. You never know in this game. I do know that the 7-OH people have been aggressive. They've bought probably 3 or 4 think tanks in Washington, D.C. In order, just through monetary contributions. And they're taking this view that we shouldn't ban anything. And that's something that has some popularity among some sectors. The Drug Policy Alliance are big advocates of not banning anything. But this is a confrontation about public policy and how you protect consumers. So I think that I'm hopeful, fingers crossed, that we're going to get across the finish line on this scheduling here in the next couple of weeks. Yeah, so the question was, what's the current status of Kratom in the state of California and what people should reasonably do about it? The California Department of Health has taken the position that based on the information that's contained in the FDA and Kratom webpage, which we're told is going to change in conjunction with, for reasons that are unknown to me, with the publication of the notice, a Federal Register notice by the DEA to schedule 7-OH. But when that happens, we're told that the FDA and Kratom webpage language will be changed as well. No specifics on what it'll change. But the problem for the Department of Public Health in California is they're connecting the two things. The entire basis of the complaint that was filed against a major Kratom manufacturer in the state of California, you look at the complaint and it hinges entirely on the language that's very poorly crafted language in the FDA and Kratom webpage, which allows the Department of Health in California to make the claim that California law relies upon that definition, and therefore all Kratom products are adulterated. I think what you're going to see is that the Department of Public Health, in identifying a major California-based manufacturer, distributor, and distribution to retailers, trying to shut them down is the first step. I think they're going to look at major kratom manufacturers outside of the state of California who are distributing their products in the state, and they're going after them next. The thing that will stop it is the revisions to the kratom, FDA and kratom webpage. And we're told that that's going to be done shortly after the publication in the Federal Register of the DEA notice. I don't know why that connection exists, but somewhere in the minds of some career bureaucrats in Washington, that makes sense. And having dealt with them, I know that there's one thing that's true, that nothing what they do makes any sense to the common person, but they're working through it. And that we're hopeful, extremely hopeful we get this resolved, because you have in the state of California hundreds of thousands of kratom consumers who rely upon the availability of kratom. We're seeing a uptick in the number of local jurisdictions in California that are passing bans based on misinformation. We try our best to fight back on those, very difficult. But we also know that AB 1088, sponsored by Assemblywoman Baines, now has been moving towards a hearing in the first or 2 weeks in June, and that will get it moving in the Senate. It passed unanimously in the House. So why we're not moving along on that? But that's something that I think we're going to see progress on as well. So maybe the confluence of events will help us there. I wish I had better news there, but.
I'm looking at your AKA YouTube chat, and I'm looking at the questions in there. It says, our pharmacy board here in Nevada just voted to classify kratom as a Schedule I, hoping the AKA can help prevent this government overreach.
So the great question. The Board of Pharmacy, now for the third time in the state of Nevada, has opened the discussion about banning kratom. And I have to be careful here because we're going to be appearing before the Board of Pharmacy in Nevada, because they, in their work session, unanimously agreed, despite strong opposition, to open a formal hearing request. So being careful about the way that you would characterize this, this is a group of buffoons who held a kangaroo court because they didn't ask a single question, not a single question of the experts that were there that would have informed them about what the truth was about natural kratom products. They weren't interested. This was a cooked deal, and it was led by the Attorney General's statutorily authorized substance abuse advisory group. And if you hear the testimony of that person who made the presentation, who, by the way, had 25 or 30 minutes to make the presentation, and everybody that spoke, Jack Henningfield, who spoke, got 3 minutes and 0 questions. This is craziness. And yet, when you heard that person representing the substance abuse group talk, she conflated 7-OH and kratom throughout her presentation, didn't make an adequate legal definition between the two or distinction about them, nor did she explain what the differences in the products were that might lead to different health consequences. So astounding to us. So we're going to be back in short order with a Board of Pharmacy formal hearing on kratom. And Kelly Dunn and I have been through this a number of times. He's got the shirts ready for all of our advocates to show up, because they may not hear us. They may not hear all those advocates in the hearing. They didn't last time because we had hundreds there, but they're going to see it. And they're going to know that what they're doing is just plain wrong. But the good news about all of this is that when they conclude the Board of Pharmacy hearing in Nevada, it then goes to a legislative body that reviews all administrative rules. And they have to pass muster in that legislative committee, and I don't think they have a chance. Because if they repeat what they did in the work session, it's just factually wrong, it is inaccurate, and it is scientifically not justified. And I think we can make that case to, in this case, the legislators if we have to.
State of California, we're gonna, I guess they're gonna discuss, something's gonna happen in June. So is it gonna be a discussion about the kratom again, or is it gonna be a vote, actual vote on the first or second week?
So the hearing that will be held in the Senate will require testimony and a vote. So this isn't an informational hearing. This is an actual hearing about AB 1088 and amendments. There will be amendments because we want to make amendments because there's some parts of that we don't like on the packaging requirements, because they use, and Assemblywoman Bain's terrific. She's a medical doctor, she has experience in this area, but she adopted the federal standard for packaging that relates to pharmaceutical products not being able to be opened by a 5-year-old kid. And there's no evidence to suggest that a 5-year-old kid's going to open a Kratom product, and there's certainly no evidence to suggest that what they stop a 5-year-old kid with is going to stop a 18-year-old or 17-year-old. I'm sorry. So yeah, there's issues there, but that hearing will take testimony and will be voted on with a vote to move out to there might be a secondary committee on the appropriations level, but it will get to the floor.
On that day when they have the hearing, will they vote on that too, or is just something going to be happening later?
So it's at discretion of the chair and how the discussion goes. At the end of the discussion and the testimony, what typically happens is someone on the panel makes a motion, and the motion would be pass with favorable recommendation, kick this to the curb and kill it. It could be amended. So, but something will happen at that hearing. One way or the other, they will move it out or they'll kill it right there.
Yeah.
And if something passed unanimously in the assembly, and this is California we're talking about. If something passes unanimously in California, that's something, and in the House. So I think that there'll be strong effort in the Senate to follow suit. And then the governor. Kelly. So Kelly said something to the effect of, are they going to get those 5 middle schoolers to come and testify about it? Yeah, we gave them some dots, they'd be there, front and center, you know. That I would like to hear those group of doctors, those emergency room doctors, come up and justify why in the hell they concluded everybody together, that's definitely Kratom. I mean, no toxicology screening, nothing. It was just bonkers, but. So typically, it's a one-off. The news media is not interested in corrections, right? We tried to sell the story. We had the evidence, and nobody picked it up. But interestingly, you now have a blue ribbon commission in the state of Georgia, led by the devil incarnate, Representative Townsend, who will have to convene hearings, and stakeholders get to testify, and we will have this discussion about what happened in the Walker County schools, because it relates to the impact the Kratom availability has on kids. And what better example than what happened in Walker County to where the doctors, and hopefully we can flesh the doctors out to come and answer what they did. But certainly we'll be able to discuss this and hopefully make it into a media release along in that fashion. So one more from you, Misty, and then we're going to call it a day. Do you have another question? Oh, well, better yet. I'm sorry, right back here. So the question was, is there any movement on import alerts on Kratom? There is in the, and I want to, do I want to say this? I'm going to say it. There is report language in the appropriations bill for FY27 that's included in the House version that's going over to the Senate that's specific, it's a public document, that specifically says that the FDA has to stop the broad import alert on Kratom, and on a de novo basis, meaning a case-by-case basis, with the burden on the FDA to prove that the Kratom imported material violates the wholesomeness and quality standards of the FDA. And I think it goes away at that point. We might get it sooner on another pathway, but that's currently in. Now, report language is not binding, but this particular issue has now been elevated to the top levels of Congress, and I think the FDA is going to listen. They'll remove everything, and then what the report language says is that if the FDA has a reasonable basis to stop an import shipment, they have the burden of proving that doesn't meet FDA standards. Right now, everything, they classify everything in Kratom as you know, as an adulterated product. They won't be able to do that anymore if this gets through. And that's something we're working on all the time. We work in politics, as you can imagine, is not easy, and sometimes, you know, it's difficult. People play games all the time, so we've been working in that environment, and we've gotten this language through. I think we can send this out, because it is a public document. There's no reason not to. We'll send to everybody so that you can see it. But we're hopeful the Senate will concur. Usually they do. They concur with it. So that's the status on import alerts. Okay. Thank all of you for being here. We appreciate you very much. I should have said this was live streamed. Some of you may not have asked the questions if I told you that. But it was recorded, and it will be available on our YouTube channel if you want to come back and replay to verify anything I said. I am certain that Michelle will be watching, among others, and so we'll see what the reactions are. But thank you for being here. We appreciate all that you do and support. Thanks. See you later.